Hi, my name's Ed Roth. I'm the director of the Central Mass Shine region, and I want to welcome you to our Medicare and More program. Today we have two guests that I'd like to introduce. Cindy Phillips from the State Shine Director. She's the State Shine Director, and she's with us this morning. And I also have Lucilia Prate. Lucilia is from the Senior Medical Patrol. And maybe, Lucilia, can you tell us a little bit about the Senior Medical Patrol, or SMP?
Sure. So the Senior Medicare Patrol program is a federally funded program. And what we do is we do a lot of outreach and education of Medicare beneficiaries, their family members, and caregivers to become more engaged in their health care, read their Medicare summary notices, understand their benefits, and we address a lot of healthcare errors, fraud, and abuse. So through our counseling and through our outreach and education, we get people then who call us with their concerns and their questions, and we help them navigate the confusing healthcare system. It's very confusing for people.
It is awful confusing, and today I have a topic that is a kind of a serious topic. It's important for every Medicare beneficiary. Starting in June, I believe, or even now in some states, Medicare is going to be sending out new Medicare cards. And Cindy, you want to tell us a little bit about what's going to happen with the new Medicare cards?
Sure. Well, the reason that there are new Medicare cards is because the federal government was very concerned about Medicare fraud and abuse, and that people would, give away their Social Security number, which is on the card, or the Medicare card, and bill erroneously, or that it would be used, for problematic issues. So the people with Medicare will receive a new Medicare card from now until the end of April 2019, depending on where they are in the country. If people who are going into Medicare will get them as they start now, and people in Massachusetts are the group that will be rolled out and get a new Medicare card as of, I guess, July 1st.
Okay, so that's great. And we knew all along that the old Medicare cards had the Social Security number on them, and a lot of folks for many years, when I got my Medicare card, I questioned it. Why is my Social Security number on my Medicare card? But just that's the way it was. But they're finally I guess, wising up a little bit, going to take the Medicare, the Social Security number off your card. And what are they going to put on the card? A random number? Is that what it's going to be, Lucilia?
Yes, it's going to be a random number on the card, and everybody will have a unique number, and that's, hopefully that will avoid a lot of the healthcare fraud and identity theft that's happened through that card. Because if you lose that card, or if you're giving your Medicare card and you're not cognizant that, that was my Social Security number I just gave somebody, anyone who steals your identity is going to wreak havoc in your life. And we've had a lot of instances where, people have been called and they've given out that number, they've given out their bank number, and they're somebody calls them under the guise of being Medicare or Social Security or, some other credible entity is calling, and they're giving out this information. That is a no-no. Do not give out any personal information ever.
Very
We've actually
important.
heard of callers or people receiving calls that a company is saying, I could get you your card sooner, if you just give me a Social Security number. So, be very aware that no one's going to call you to expedite that process. Right.
So there's even scams with this, and the process is going to be, there's a certain time frame when Medicare will start mailing these new cards to Massachusetts beneficiaries, and maybe the beneficiaries of a couple of other states. So once somebody gets the new card, what's the process? What should they do with it? Should they start using it immediately? Should they destroy their old card, or what if somebody forgets?
Hit the nail on the head. I think people need to carry their Medicare card with them to their doctor's offices and medical visits and destroy their old card. Yeah.
Yeah, because that's important. We don't want your old card. Destroy your old card. We don't need it around anymore if you get the new ones. And I know that the new Medicare card is gonna not be the same as the old one. I know the old one had some information on it, and the new one is not gonna have the same type of information. I had heard that you're not gonna have to sign the new Medicare card. Is that true?
You won't have to sign it, and there also is not listed a gender. And there's a little bit of Spanish translation on it, which is helpful.
Okay, so that your gender is no longer on your Medicare card, but it is going to have the other important information, like the effective date of your Medicare Part B and your effective date of your Part A. So when you take it to your doctor will have all that information. Now, I am sure providers and hospitals are well aware, the pharmacists are well aware that this transition is happening.
Yes, our understanding is that yes, they are. There's a campaign at the Centers for Medicare and Medicaid Services to reach out to providers. I would encourage people who are listening to this program to, when they go to their doctor, their next visit, to in fact ask, do you guys have any information on the new Medicare card? And if they don't, please call us and let us know, because we can get them posters. We can also inform Centers for Medicare and Medicaid Services that, X, Y, and Z doctor or, facility
Provider or
does
whatever
not
it is.
have information. They knew nothing about the new Medicare card. That would be very important for us to know and to pass on. But our understanding is, that there has been a lot of outreach done to providers.
Right.
That's great. That's great. So that's important. We need to make sure the providers are up on this thing as well. And again, it's important for our beneficiaries too, just to be comfortable. The card is coming. We don't want you panicking. Oh, I haven't got my card yet. What am I going to do? It's a process. And when we find out that they are starting to mail Massachusetts, there certainly will be a public effort to let people know that the process has started, and we can do that. But it's very important that, as both Lucilia and Cindy had mentioned, and we'll talk about it a little bit more. Scams are going on. Any example of any scams that we've heard of? I think maybe Cindy or Lucilia might have mentioned people are calling or something.
Well, we recently got a call just last week from a woman who had been called by a gentleman, and they were asking her to confirm her name. New Medicare cards was being sent out. They wanted a confirmation of her name, her Medicare number, her address. It sounded very legit. The woman said it sounded so legitimate. She said, I couldn't believe I gave him all that information.
Oh.
And then she gave the information out. She didn't know what to do. So she called Medicare. Medicare told her to call us. We, wrote this up because we keep a track of all these cases that are called into us on a national database. We reported it to CMS. She was told by me to call the local police, to call the Office of the Attorney General, to call the FTC, to the Federal Trade Commission, to make sure that they knew and that it's got reported to the 3 credit companies. And, we told her to keep in touch with us. And, we'll wait. She's going to wait and see. She had to go and cancel her bank account. And I told her to put a freeze on any credit cards that she may have. You just don't know what people are going to do.
You'll have to watch all her bills
coming in. Her Medicare summary notices. She called Medicare and alluded, told them that this had happened. But, these are unnecessary phone calls that this poor woman had to make. She was panic stricken.
She was in tears, probably, right?
Yeah, she was just a nervous wreck.
Yeah.
A nervous wreck.
Yeah.
I have to do all of this? I said, yeah, unfortunately you do.
Call them what you want to call them. They're preying on senior citizens with some kind of story, and we got to caution everybody: never, ever, ever, ever give out your Medicare number, or particularly in these coming months, anytime really, but in these coming months in particular, you're giving out your Social Security number, okay? And there's no reason you should give your Social Security number out to anybody for any reason. if Medicare doesn't call you, and it's my understanding Medicare will not call you and ask you for your Medicare number. Is that correct?
Well, Medicare will not call you unless you have filed a complaint, and Medicare needs to follow up on something.
Oh, okay.
Medicare doesn't just arbitrarily pick up the phone and say, well, let me call Ed Roth. But if you filed a complaint about something, you filed something with S&P, or you filed a complaint with, Medicare.gov, they may follow up and call you. Okay, at which point you have sort of invited that because you have a pending issue or a pending case with them.
Then it's legitimate.
Yeah, it's a legitimate call. But I strongly suggest that if people are not, when somebody calls you and asks you for that kind of personal information, you don't have to give it out immediately. You can say to them, I'm not comfortable doing this. Can I have your name and your number? And where you're calling me from, and then call them back. But even that, people are so creative, these scam artists are so creative, that, they create these phantom companies, if you're really trying to scam people, they get very creative. So you can never be too careful, I say to people.
So the other thing you can do if you're concerned about when you're getting your card, when you feel like, anxious about it and you want to respond to calls, is you can set up a My Medicare account, and that way you can find out when your card is coming out. Has your card been sent? No. Will it be sent? Yes. Is it on the way? Yes or no? And you have a better idea, and that's a legitimate source.
Okay, and you do that. How do you do that, Cindy? You do that through Medicare.gov?
Yeah.
Is it Medicare.gov?
It's a Medicare website.
Medicare website, okay. And you can set up your own Medicare account there. You can get all kinds of information on that Medicare. You can get all kinds of your Medicare information. It's all there for you to get. So again, that's a good idea, and that'd be good if folks can do that. You can also, I heard now, these new Medicare cards, if you lose your Medicare card, something happens to your new Medicare card, you can print one directly yourself
Right off that
online
site.
through that
Exactly.
site, through
Right.
that
It's
account.
very handy.
So it may be, something like that may be very handy for an awful lot of folks. And also I think that the old Medicare card, I was reluctant to carry it, to be honest with you, because I was afraid if I lost my wallet. So maybe the new one, at least, you can carry it a little bit more freely, because the number is not necessarily a significant number costing you identity theft and stuff. Although it is significant to Medicare, you're still open to Medicare fraud if somebody gets your Medicare number. But it's not. It's like years ago, folks will recall they used to have your Social Security number and your driver's license. Goodness gracious, it was 15 to 20 years ago when they changed that. It's good to see Medicare is kind of catching up and putting a random number on a Medicare card. I mean, I think that's going to be very helpful to an awful lot of folks.
Well, another thing too is if you forget to bring your card to your doctor's office or the pharmacist, there will be a site that they can check, set up in June. So there is another way to do it, just in case you forget to bring your card.
They'll cross-check.
There is, yeah, because I know I may have cheated. I scratched off a couple of the numbers on my Medicare card and the one I carried in my wallet, and I figured if I was showing it to somebody, I could give them those numbers because I knew what they were. But I really didn't want to have them out in the public sector. So that's great. That's one good opportunity, I think, for the new Medicare card. I think folks will be able to carry it. A little concern I've had for a while, Cindy, and I think I expressed it at a couple of seminars with me at. It's an opportunity. That would be an opportunity for Medicare to go with a plastic card. They decided to continue with the paper.
Apparently, plastic's pretty expensive.
I guess
Very
I guess it
Millions
is.
of people.
And this is a very expensive endeavor. It's and a tedious, overwhelming
Yeah.
endeavor. 58 million Medicare beneficiaries
Wow,
across the country. So they're going to have to process
It's going to be a big process.
It's a big,
sure.
big process.
It's a challenge. It's a challenge into Medicare. It really
Well,
is.
just think about the healthcare systems that have had to change numbers that accommodate a new number. So
Yeah,
very
it's-
expensive.
So I think we all need to be patient and a little understanding.
And how long
as
is
we make
this
the
process going to take? Now, if you don't get your card, I'm told your old number will be active for a period of time. Is that true?
Yes.
Will be active until December of 2019. You could
Oh,
use either
okay.
number.
Okay.
You have to, yeah.
So you could use either number until 2019. Then that old number with your Social Security, that old card with your Social Security number, no longer any good after 2019.
Right. January
Okay,
1st, 2020.
Okay.
That's it.
That's it. So if you don't get the card or is you can still have your old number, but the new number should be coming. If you don't get a new card, within maybe a reasonable time that
Well,
they
by
call.
April of
April
2019.
Yeah.
April 2019, if one has not received a card,
April of
they
2019.
should be speaking up and letting people
Okay.
know.
And it's probably because they have your wrong address that you didn't get your
Yeah.
card.
Address is important. Now,
Yeah.
address is important because these cards, like these cards are coming basically through Medicare cards, but they want the addresses they use are the addresses that's in your Social Security record. So it's really, you want to make sure that Social Security has your latest address.
Right.
Because if they don't, there could be a problem. If you move in the interim, you want to make sure that you let Social Security know what your new address is. Don't delay on that. Some of us may delay on that sometimes. Oh, we haven't got to call Social Security. My check is direct deposit. Okay, so your check's direct deposit. What does Social Security care where I live? Well, in this particular case, you're going to get a very important document in that address that Social Security has. So you need to make sure Social Security has your updated address. That's extremely important. And so if if they don't have it, get it done. How do I know? I think if you're getting mail from Social Security, last year you got a Social Security statement. Most Medicare beneficiaries do. People that receive Social Security do. You got a statement from Social Security indicating what your Social Security was going to be last year or this year, and a 1099, all of that stuff. If you got that stuff at your address, fine. Social Security has your correct address. If you didn't get anything from Social Security, then there may be a problem, and you may want to call Social Security. They do mail you a couple of times a year, definitely. If you're not getting a check in the mail, they mail you a couple of times a year with your benefit statement and your 1099. You're not getting that information, that's a problem. So you need to call them to make sure they have the correct address, because if they don't have the address, you're probably not going to get a card. Is that fair to say?
Yes.
I think that's the
right.
case, yeah. Yeah, I think
And
that's the
do
case.
we know the number offhand?
I think we can put it.
Could probably
screen.
let it
We'll
run.
put it right in the screen, the
Sure.
Social
Yeah.
Security number, yeah. We should. I think it's,
That-
I think it's 1-800-772-1213.
That's exactly right, Ed.
That's exactly, see, she was
call it
testing me.
enough.
So it's 1-800-772-1213. That's the Social Security, the main number of Social Security. Make sure they have your correct address. That's a very important piece of information. Cards of paper. How can we help people with that? Because I know I'm going to take my card out of my wallet and I'm going to give it to a provider, and the card goes in the pocket, you forget it's there, pants go in the wash, card destroyed. Is there anything we can do to help people with that?
Yes. We are getting sleeves to plastic sleeves so that people can put their cards in.
Oh, wow.
And we will have those available soon.
Great.
Right.
So somebody's going to be able to put their Social Security card in a plastic sleeve. The opportunity decreases where the card could where
Some
the card could be
protection.
destroyed. A little bit of protection.
Yeah.
Because I was concerned about that. Paper
Right.
gets eaten up by the wash machine on many occasions. So
And some folks have asked if they could laminate the card, and it's possible. We're just concerned that when the provider goes to make a copy of it on their machine, that it might not show up very well. You know, if
okay,
it's-
we can test that out.
We'll test
I think
it.
we can test that out because I know
Put the both of the
in
wash,
the old
too.
one, the old card, they kind of weren't too happy if you eliminated your Medicare card. I
Right,
know there
right.
was a problem with that because you had to sign it. I don't think you have to
No,
sign a new card.
There's no way to sign it, so don't sign it.
So you don't have to sign it. Isn't that cool, huh? Isn't
Mm-hmm.
that cool? That's great. We've talked about this Medicare card issue. We've talked about some important points.
I think one very important point that we should mention is that with these changes, benefits will not change. There will be no changes to benefits. So I think
good point.
for people to really understand that, that's important.
No change to benefits as a
No.
result of the change
No.
in your Medicare number. Nothing. No change in your Social Security benefits. No change in your medical benefits. Everything's going to stay the same. Eventually, your providers, whether it be Fallon, Tufts, a Medicare plan, they'll all have that information. So everything should mix in pretty well
Yep.
as far as it goes. If it doesn't, if you have a problem with some of that stuff, a provider problem with somebody not having the right number, a question on something, please feel free to call Shine. And of course, the number is up there. Or call SMP. We'll have Lucilia's number up there. Lucilia's number is very important. Medicare fraud and abuse, okay? That's what they deal. That's what they investigate. If you feel that fraud has been committed using your Medicare number, call them. They're the people that are going to investigate that
If you
stuff.
see anything on a Medicare summary notice that is unfamiliar to you or is questionable, I tell people, use your gut. Our gut is very important. It really, something doesn't feel right. It probably isn't. And so call us. We're happy to help. That's what we do.
Right, right. I
Okay.
mean, you could be living in Massachusetts and you see a Medicare summary notice, and some outfit from Florida is billing you for some piece of durable medical equipment or something like that. That happens, folks.
It happens
These
often.
people are brazen, okay? So it's something you got to watch out. It might not be costing you a lot of money, but it's certainly, Medicare fraud costs Medicare billions of dollars, okay? Costs Medicare a ton of money, and I think our Medicare beneficiaries are kind of the front line of stopping that, okay? So it's something that even some of our more elderly beneficiaries can pay attention to. That's your contribution to helping Medicare. So I think that's a great plan. So it's a great idea.
The one thing your group does do when it's out in the community doing presentations is help people understand what the Medicare summary notice is and how to read it.
Yeah.
I think that's the hard part because it's confusing.
Because it's a very confusing
Yeah,
piece of paper.
yeah.
First thing people should understand is that it's mine. It's my name. You know, these digits belong to my Medicare card because not the entire number is on there. And this is where I live. It belongs to me. But here I am. I didn't see this physician.
Right.
I don't understand this. And this happens. This happens quite frequently where people get bills under their name and they never stepped foot into a particular institution. Okay? I can think of 3 right off the top instances that we've had to help people out.
And it's having people complain or come to get help where, providers were billing erroneously or for, 24 visits in one day are discovered across the country.
That's correct.
It's very,
Across the country.
very important
So
people
it's-
speak
it's-
up and pay attention.
A knowledgeable beneficiary is the biggest weapon against fighting fraud and abuse.
And it
really
does
is.
any question, people question things, it's okay to question. We should be asking questions of our providers. Do I really need that?
Right.
Is there another alternative test? Or
That's right.
Yeah, people really need to.
And I think sometimes my generation falls into that crack. Oh, well, the doctor said so. Well, that's fine, but maybe there's another deal you can go through and look at.
Yeah.
And be a little more, it's your health care, and you should be able to do what if you got a question, question.
Yeah.
It's not bad to question authority now and then. Okay.
Especially regarding your health care.
Yes,
Yeah.
yes. I
All
tell
you've got.
people all the time, you may have never been the CEO and president of a company, and you may never be, but you are the president and CEO of your body. And what you say is really what should be done. You need to be in charge.
Yeah, and Shine works very closely with Lucelia and Senior Medicare Patrol too. And we're in just about every town in Massachusetts and in many other locations. So if somebody comes in their own town with a Medicare summary notice they don't understand, you can certainly run it by us, and we'll refer it to SMP or work together with them to help resolve any questions or problems.
Yeah, we do work together, and again, in Central Massachusetts, we're in probably about 50 or so senior centers throughout Central Massachusetts. We have counselors that are options counselors in all of the HSAPs in Central Massachusetts, and they work very hard to review people's Medicare and solve their Medicare questions. Medicare is ever evolving program of complexity. They're very complex, ever evolving. Okay, and it's going to continue to evolve, and hopefully we'll be here for a number more years to answer beneficiaries' questions, because it's going to get more complex. That's just the nature of the current business. Medicare is going to get more complex.
Well, the other important thing I think to note is that it is your Medicare. You've been paying into it throughout your whole work history. So don't let anybody take your
it away.
Medicare from you. Guard it with your life. It is your health and your health care. But it's very important to stay tuned.
And
to
guard
what
your
can
new
happen
card.
with Medicare. That's right. Guard that card.
Guard that new card, because medical identity theft is very costly. It can cost you your life, So you need to be careful.
Yeah,
You don't want to get mixed up by, Lucelia Prate's number getting mixed up with Cindy's or anyone else's, because then that's what they have there for your health care, your health record. You don't want to get things botched up that way. So guard those cards. Don't let anybody use it. Don't, just guard them as you guarded the other one.
Yep. Okay. All right. Well, we're gonna wrap it up here for this program. I want to thank Lucelia and Cindy for joining us. And remember, those cards are coming. Make sure Social Security has your correct address, and hopefully there'll be a successful transition to all of these 58 million
We
Medicare
hope.
beneficiaries throughout the country. And again, thank you for listening. And remember, check our website, shinema.org, and we'll just see what's going on there. Thank you. Bye-bye.